The series is essentially about psychoanalysis, which is a very specialized branch of clinical psychology, which deals with the understanding of unconscious mind. That it believes that behind any simple behavior, habit, action, thought, there's a lot of complexity, and we live a large part of our lives, without being really aware of many of the things inside us, but that these things and these various forces, they continue to influence us. Another very important thing in contemporary psychoanalysis is that when we speak about unconscious, so unconscious is not something which exists as a concrete object. I mean, psychoanalysis really does not believe in that you can go into a state and the unconscious will come out of its own. Unconscious is more like a clay, or a stone, and you have to give it some form. So unconscious in some way is like mud, and through therapy, in psychoanalysis, we develop a language for an unconscious, we develop images for unconscious, so that unconscious starts revealing itself. Yeah. Okay. We'll now start with today's talk, which is on addictions and compulsive behaviors. So I would like to ask you all that what do you think are most common addictions that we see, from your own experience, personal experience, or things that you may have seen in your family, your friend circle, or stuff like that? Please. Drugs, okay, yeah. Alcohol, yeah. Smoking, yeah. True.
Growing generation, internet, etc.
Very true. Internet, Facebook, cell phones. Anything else?
To lose the temper.
Losing the temper.
Despite you don't want to lose it.
You don't want to lose it. Okay. Yeah, that could be related to addiction in some way. Yeah. Anything else?
Abusing, very common.
Abusing, very common. Yeah, okay. Anything else? Procrastination. Okay. Yeah, I mean, what all you have said, abusing, procrastination, they are related a lot to addictions, and we just get to see.
Other people.
Yeah.
Other people.
Yeah. People at times see addictions can be to substances. They can be to people. At times there are some people who are addicted to relationships. They are in one relationship that breaks. They have to go into another relationship. They can't be single, kind of thing. So addiction to people. Yeah. So a lot of things, right?
Addiction to exercising.
Very true. Addiction to exercise, yeah.
Branded addiction.
There are some people who would really feel, very depressed and fat if they don't hit the gym for a single day. I have a client like that whose, muscles would really tear and swell and stuff like that. Yeah.
Addiction to walking is also addiction.
What?
Walking.
Yeah, I mean, see, that's what we are going to see in today's talk, that any activity has a tendency of becoming a compulsion, and then a tendency of becoming an addiction, kind of thing, right? So we would start, and I would in fact start with a short video, so that it's a very nice video made by some group of students on internet addiction. It's a very simple one, but it's beautiful. It just gives you the gist of what addiction is. Can we have the lights switched off? Yeah, so any comments on the video,
Yeah, activities list went too fast.
Okay. okay. That I couldn't have controlled, sorry about that. Yeah.
These are things that normally happen to people who start getting familiarized with the internet.
Right.
They happen within a month or two.
Right.
And they can't immediately be branded as addiction phenomena.
Right.
But of course the rest of the thing, the rehab stuff, that is useful. People shouldn't forget all that.
Right. Yeah, see, I mean, it's also that when at times, you make a video, you are at your creative best, so you don't really at times portray, the exact facts, but I thought this was a very interesting video to give a gist of, what really addiction is, kind of thing. Yeah. So anyways, we would, go to that just right away in detail, that what addiction is. Right. So see, when we are talking about addictions, also because, we also have to understand that all of us have very strong attitudes towards addiction. We can be pro it, we can be against it, we can be ambivalent about it, So we would, in diagnosing addiction, that who is an addict, in treating an addict, and also in dealing with our own selves, if we have an addiction, it would be highly influenced by the kind of attitude and assumptions we are holding towards addiction. Yeah. So we have to, keep in mind that we'll be coming to that. But when we are talking about addictions, so some people are experimenters. I think a lot of us, may have, at some point in our life experimented with something, that we have gone to a party or we have gone on a vacation, or maybe we are somewhere and we see someone and we just feel like trying it. एक बार try करके देख लेते हैं कि क्या होता है, kind of thing. At times when we have say a big occasion and stuff like that, so we kind of would want to try something which could be addictive. Someone here was talking about getting addicted to people. So one of the clients whom I saw, it was very interesting that he had, he had a very strong moralistic bent in a very stable marriage. And one fine day he just decided to pack up and go to Bangkok on a vacation kind of thing. And there, as a part of it, he kind of experimented with with his sexuality kind of thing. And when he came back, he really felt like having casual sex again and again kind of thing. So much so that it almost sort of became an addiction. So but coming back to it, not all classes of behaviors, and like simply the use of an addictive substance would not be called an addiction. There need to be several things in place which would make it qualify as an addiction. I'm really not going into the medical criteria because that's very dry. It talks in terms of various things, but we'll just look it from a very simple angle. That someone gets addicted to something, and addiction, as I said, would be to anything when that addictive object or substance or anything that they are using, they start using it to deal with what they are unhappy about, to deal with what they are distressed about, or to deal with whatever is missing in their life. So that's the time that that they would start coming into the grip of addiction. That they would be unable to renounce this high regardless of various dangers and threats and time wastage and money wastage which may be associated with it. So that's what it is, and I'll just to illustrate this thing, I'll just read out a short diary entry which was written by one of my patients who was in who was into multiple substance use. So he wrote this short diary entry after a long while in therapy. So he wrote that as a child I loved my silky blanket. I took it wherever I went. I never slept without it. I grew up and blanket became smaller and smaller. Still, I refused to give it up because no one was there. I felt alone. When blanket became too small, too very small, I took to cannabis. Cannabis has been the best friend. It takes away everything: tension, stress, anger, fear, excitement, and it puts me into a relaxed state. So if we look at this very small diary entry, so when I was reading it out and when you were hearing it, so what would you make out from it? Any reactions to it? Yeah. Escapism. Okay. Yeah.
Parents and child, he was alone.
Yeah,
He was having a problem of loneliness when he was in childhood.
Yeah. Your point is very relevant, and we'll be coming to it when we come to the third part, that how do we deal and heal with these people. Yeah, please.
See, actually, habit is a phenomena that is very difficult to leave, because when you remove H, a bit is left.
True.
When you remove A, bit is left. When you remove B, it is left.
True. Yeah. So, as you said, what this person is essentially talking about, now we may have an attitude towards it, that he's right, wrong, he's an escapist, or not an escapist. I mean, let's really not go into it. Let's take it at the face value for the moment. We have time to go into it. So, this person is essentially saying that there has been something very deep and chronic missing in his life from a very, very long time, and he has been forming attachments, so the first attachment was to blanket, and then the attachment was to cannabis. In between there were other attachments also, but for the sake of putting it in a very succinct form, I have edited that entire thing. So that's what a compulsive drug use or addiction is, that when you start using it to take care of whatever is problematic inside, right? And also an interesting thing happens is that if the drug or anything that they are addicted to is taken away from these people, and that's a main reason that why many rehabs fail. People go into rehabs for 3 months, 6 months, they're doing all interesting things, they are they are out from it, their withdrawal period is over, still they come back and they kind of bounce back into addiction. So that's like one main reason that if the drug is taken away, then these people actually suffer from some psychological problems and symptoms beyond the withdrawal period. It could be depression, it could be suicidal attempt, acts of violence, stealing, running away. I mean, various things. I couldn't have really mentioned all of these kind of things, And in fact, I also saw, one such case that when he was on an addictive substance, he was like, very calmed down, very mellowed down. But when he went, for so-called, rehab therapy, he was out of it. And so this is really not the withdrawal phase, because at times people do experience very strong psychological symptoms when they are in the withdrawal period. So this was much beyond the medical withdrawal period, that he would get very anxious, very paranoid, and he would be very rageful kind of thing. So we could see that the drug was somewhere taking care of all these anxieties, and it was keeping him in an intact and some kind of a functional state. Right? Yeah.
Hi, I have a question.
Yeah, please.
I just wanted to ask, you mentioned something about even after people come back from rehab.
Right.
The core problem remains.
Yeah.
In the case of, for example, this person with a blanket and then after the cannabis,
Yeah.
The blanket may have become small, but the physical presence of the blanket remained. I mean, the blanket was still there, or was it taken away from him? Because if the blanket is still there, no matter how small it is, it's there.
Right. Yeah.
So I was just wondering what, in this case, what would cause a transition from that object to maybe another object or substance in this case?
Right, I mean, yeah, in the history there was obviously this point showing that it was taken away kind of thing. Yeah.
Excuse me.
Yeah.
Could it be because some people hastily embark on a quest for the ego ideal? What they want to feel like, what grand people they want to be.
Right.
With hasty ideals, smaller ideals put together, and then they don't find any, target, and they become defeatist too early, and soon they discover these drugs and cannabis and other condiments, and in fact they are gradually just losing hope, never achieving what they wanted to be.
Yeah, sure.
And there's a good substitute also.
Yeah.
Because the addicted state is, the intoxicated state is also a good substitute for the ego ideal, because it is as worthy as the ego ideal, which was hastily put together.
True.
A highly placed person, not defeatist. They are chain smoker and the other thing. What you talk about them? They are not defeatist. I have seen a neurosurgeon of top order is a chain smoker.
Right.
Yes, but it's something he was looking for. That must be small addiction with small.
I think we can just go on, because many of these issues, would be coming up later in a very detailed form, kind of thing. Yes, with any kind of.
We'll take the questions later. We can carry on with Pulkit's talk.
Okay. Yeah, so you have seen that on the slide, kind of thing, but I'm just kind of, quickly rushing through it, that, when do we start calling something as an addiction, so that the person will experience a difficulty in limiting its intake, so it will be hard for them to put a tab on it, that now I'm done with it, or it's this much amount that I need, they'll be needing more and more and more of it. They'll be like, going on with it. They'll experience a characteristic loss of control, that people, they kind of, when they are addicted to something, even if they try to stay away from it, and it's same for, it's for drugs, it's for internet, it's for, various things, that they would really find it hard to, limit their time, kind of thing. And that addiction would also be at times their mental companion, even when they are not with that substance or with that object, they'll have very vivid fantasies. Coming back to my patient, that when he was off the drugs also, so he would think of cannabis, with such fond memories. He'd have such intense fond memories that that was a very good or wonderful thing, kind of thing. So it's a mental companion for them. They'll be thinking about it, they'll be thinking of the good times with it. They need more and more of it to achieve the same high, So that's what we call in medical language the tolerance. And yeah, this point is very important, that the addiction becomes the lodestar, that it becomes the guiding principle and the life of the person starts revolving around that kind of thing. So if someone is addicted to Facebook, they'll be really thinking, that's the time when most of the people, post updates on the Facebook, so I need to be, so I need to plan my life like that I need to be available at that hour on the Facebook to see all fresh updates, so something like that. And the last thing is that because of addiction, the relationships of the person would start getting disturbed. Now this is again a chicken and an egg story, because disturbed relationships and addiction, they go like chicken and egg, So, but that does happen, that once you become addicted to something, you start ignoring people in your life, and various problems come up. Right. People also start disregarding, the consequences of addiction. That they would, that even if it's really killing a lot into their time, impacting them in an adverse way, they would still, be very fine with it. And yeah, that they would have withdrawal symptoms, which could be physical and which could be emotional, psychological as well. That when they would be away from that thing, they would start feeling depressed, irritable, kind of thing. So all these things happen. Right, so that was the first part. Anyone would like to, comment or ask on this first part? I mean, one or two questions and then we move on, if anyone has.
Lack of feelings, maybe. Lack of feelings in parents. Non-sharing of what is happening.
Right, yeah.
Simple problems, but complicated solutions.
Yes, but I think what he is pointing out, people become distorted there is flatness of affect with certain psychological disorders. But I think what this gentleman is pointing out is some people become distorted in affect. They react in different way. They try to learn some new technology or something, but in essence they are just reacting differently to all situations. And having few emotions.
How is it that they can be issued? Your points, addiction becomes a roadstar. This is the most problem we face, like internet addiction, which is very common.
Yeah.
Like students, they are into the Facebook and they think it's the right thing. And if you are saying it's mental door is closed, because as you have yourself said, that this is that updating yourself, and people say that they enjoy, they relax. In that case, it becomes very difficult.
Yeah, it is a really hair-splitting exercise, to deal with someone like that. But there's a lot of hope, still. Yeah.
Are you talking smoking?
Yeah. I'm actually not speaking so much about smoking and drugs. I'm making references because I think that everyone knows is addiction. So when I'm speaking, I'm going into slightly more contemporary phenomena that we are seeing. Yeah, there was one more person. Yeah.
Can a person's ideology also somehow become like an addiction? Can it be classified as an addiction in some cases?
Yeah, I mean, see, when we are talking in psychoanalytical terms, so then it can be, because it's like, it is not, see, when we are trying to understand addiction, it's not about what you are addicted to, but it's about this process and what purpose and function is the addiction serving for you.
See, I have a question.
Yeah.
Addiction is not always bad, because you see the whole Arab revolution
Very true.
happening over
Yeah.
Facebook and Twitter. So it's not always bad, and it brings the world very close, in a globalized world. The internet is a free, highway for, connecting people all over the world. It's not actually, like when we say reading books, it always comes in the intellectual domain. Then why it's surfing internet for long hours, or why is it bad? Why is it considered addiction? It is also enhancing our knowledge.
Right. Yeah, I think that's a very relevant point, and I'd like to add to that yes, addictions do have some role, and I think also, even if an addiction is destructive, and the next part actually talks about that even though there are at times so many addictions which look really destructive, they still have a very useful function and purpose in that person's life. Many times addictions are simply holding the person together into one piece. If the person is not addicted to something, maybe they'll have a breakdown kind of thing. So addictions, I mean, they have a very important function and purpose in the person's life, and they are, in that sense, they are not bad. They may be very dysfunctional ways of coping, but it is still coping. It's still like an anchor point which the person is holding on to. Okay.
Excuse me, do you also include like compulsive behaviors or repetitive behavior, like somebody just watching his or her hands? Do you also include that in addiction, or?
Yeah, see, because as I said, it's not about what you are doing, but the psychological function it's serving for you. So if that compulsion, and there are certain classes of compulsive behavior that many times when people are very empty from inside, then they really get engrossed in very elaborate kind of compulsive rituals, because it helps them to distract from what may be very bothersome inside of them, kind of thing. So in that sense they can be. Okay, time for like video and another short video, and I'm sorry if this again looks like a bit racing, but it's a very interesting thing. It's a very interesting video which tells people like why should you be taking tequila, kind of thing. So it's on that. So it's like that, but it really highlights some of the important things that we are going to talk about. To lights switch off. Oh, sorry, I played the wrong video. Sorry, just a second. Yeah. That was to come later.
Do you have feelings of inadequacy? Do you suffer from shyness? Do you sometimes wish you were more assertive? If you answered yes to any of these questions, ask your doctor or pharmacist about tequila. Tequila is the safe, natural way to feel better and more confident about yourself and your actions. Tequila can help ease you out of your shyness and let you tell the world that you're ready and willing to do just about anything. You'll notice the benefits of tequila almost immediately, and with a regimen of regular doses, you can overcome any obstacles that prevent you from living the life you want to live. Shyness and awkwardness will be a thing of the past, and you'll discover many talents you never knew you had. Stop hiding and start living with tequila. Tequila may not be right for everyone. Women who are pregnant or nursing should not use tequila. However, women who wouldn't mind nursing or becoming pregnant are encouraged to try it. Side effects may include dizziness, nausea, vomiting, incarceration, erotic lustfulness, loss of motor control, loss of clothing, loss of money, loss of virginity, delusions of grandeur, table dancing, headache, dehydration, dry out, and a desire to sing karaoke and play all-night rounds of strip poker, truth or dare, and naked twister. Warning, the consumption of alcohol may make you think you're whispering when you're not. It's a major factor in dancing like a retard. May cause you to tell your friends over and over again that you're in love with them. Also may cause you to think you can sing. Alcohol may lead you to believe that ex-lovers are really dying for you to telephone them at 4 in the morning. Alcohol may make you think you can logically converse with members of the opposite sex without spinning. It may create the illusion that you are tougher, smarter, faster, and better looking than most people. And it may lead you to think people are laughing with you. Alcohol may cause pregnancy, and it also may be a major factor in getting your ass kicked. So what are you waiting for? Stop hiding and start living with tequila.
Okay, lights on please. Yeah, so that was why you should have tequila and why also you should not have tequila. So very good one. So but what did we make out from this video, this short racing video? Anyone, that I mean, that's a very obvious thing that you should not have tequila, and they emphasize quite a lot on it. But what's like the thing that's not maybe so obvious? It's also somewhat obvious, but not so obvious. So, yeah.
The warning part when ran off like faster than the good sides.
Yeah, true. That's the standard thing for all advertisements, Yeah, okay. Anything else? What about the beginning part?
It's also that irrespective of the consequences of the repercussions,
Yeah.
if you have a hollow, if you have a void and need,
Yeah.
that is always going to take precedent over the darker side.
True. Yeah. So it talks about some kind of a void, vacuum struggle.
Bad smell which can repel the other person.
I didn't get it, yeah.
After consuming tequila, bad smell, which can repel
The other person, yeah. That's a very standard thing, I'm actually looking, in psychoanalysis, we always tend to look for very non-standard things. So if someone says that this is a pencil, we will not really, say, oh, we know that it's a pencil, so it has to be something else, So it goes like this, Yeah. So, but yeah, so the first part of the video, it actually does talk about that, it talks about some kind of a struggle, that if you are struggling with something,
then there's still a hope.
Then there's still a hope. So, ma'am, what you said, I also fully agree with you, addictions are not bad, because they may be giving us a very dysfunctional hope, but for some people, in fact, that also has a value and function,
But why are we saying for some people? I think hope is something which every human man.
Right, but actually, yeah. I think you corrected me quite well, but when you speak like this, you can't be going on really, promoting addiction also, so you have to kind of, make, but I agree with you in principle, Yeah, so coming to, so now we'll be going to what you kind of heard in this tequila thing. We'll be just taking that in a refined, slightly psychoanalytical kind of language. That how do we understand addiction? That what could really compel someone to become an addict? Right. I think someone needs to help me with that. I'm kind of technologically challenged. Yeah, that's a good defense though. No, I would say that I have had my own addictions, so to say, because otherwise you don't feel so drawn to a topic that you do a 2-hour thing on it, if you don't have an addiction, Right. Okay, so the first cause, or the first reason that why someone could be addicted is that addiction may be an emotional shield, meaning that it can provide solace from intense, disturbing emotions. Right. So for many people, what happens is that, see, we all have, pain is something which is part and parcel of everyone's life. We all of us have had intense pain in our life, kind of thing. But at the same time, our capacity to bear the pain, or capacity to deal with that pain really differs from one individual to another individual, and most of the times it has to do something with our initial development as a person, kind of thing. It has to do with both the initial development as a person, and even if we have had a good initial development, if we really go through a very traumatic life crisis at a later stage, our capacity to be, experience and deal with the pain would be really hampered. So when someone's pain becomes very overwhelming, that could be one point that they start, going into an addiction. Because, what does the addiction do is, it's a kind of a dissociated state. You are not yourself for a while, or you go into like a very, nice, rosy kind of a world, that, at times, like people who are addicted to internet, or also to alcohol, or also to drugs, they say that, that when we take that, we are in a very different plane, kind of thing. It's like, we are relaxed, things are happy, we are really not bothered about what's happening in our life. So for many people, it's like a shield against that painful emotional state. So what does addiction generally do is that it numbs these very intense emotions. That if you are feeling very lonely, if you are feeling very empty, if you are depressed, if you are feeling a lot of meaninglessness in your life, if there's a lot of rage, in our Indian culture, especially, rage is a very, very difficult emotion, because we are a very close-knit culture, and we, there's a lot of high value placed on relations, so it's very hard for people at times to, express and deal with their rage, so they either repress it, or it comes out in a very violent kind of a form, but there's hardly any middle ground to that kind of thing, So rage is an important thing. Shame, many people really struggle with feelings of shame, that they are really not good enough, and feelings of rejection. So there was this client of mine, and if she had a fight with her boyfriend kind of thing, it was very important for her to kind of go out and have a casual sexual encounter kind of thing, and by fight I mean a very minor thing. It's not that kind of fight, but it was like something that you would normally have on a day-to-day basis, that someone says I'm like 1 hour late, and you kind of. So there were obviously many other angles to this casual sex encounter also, but one thing that she would say is that when I feel rejected, my body starts behaving very violently, that I feel so much restless inside that I need to really, go out with someone else to get rid of this emotional state. So, and when she would, have that encounter, she would feel very relaxed, she would feel, like that, as if that all the tension has been drained out kind of thing, So that is like one thing. Right. It is, as I said, it's also related to a developmental capacity, in the sense that all of us, see, how do we learn to bear pain, how do we learn to deal with the pain? It's that if in our initial days of life, we have had people around us, who kind of, provided us with soothing, holding whenever we were distressed, So if we got an optimum level of that, we develop a capacity to provide soothing and nurturing and holding to our own selves. If we didn't get that, and by that, please, don't take, because people often say that, psychoanalysis is really bad, it just ends up, blaming parents, So by that, I really don't mean, that someone's parents were very horrible. There are some cases where parents have been very horrible, I would also say that. But there are also many cases where there has been a simple mismatch, between what the child's needs were and what they were getting, and the perception they ended up having of the whole situation. So when we are talking that they did not get enough of that, so we are also talking a lot about how things were externally and how the child or the person was also perceiving them internally, right? And addicted individuals, they get addicted because they need a soothing anchor. They need someone to take care of their distress, of their pain, of their emptiness. And another interesting thing happens, that in people who do not have a sufficient capacity to soothe their own selves, emotions, they appear to be very threatening. So people, that when they come to you, they would, report in these kind of words that I feel I'm crumbling down, I'm going to pieces. Any emotion, anxiety, pain, rage, will make, it sorts of, brings up a strong fear, that they would be like, blown apart, they would be going down to pieces, and all very primitive kinds of anxieties, Right, and then based on their personality and experiences, the person looks for objects, So how someone chooses some object is a very complex phenomenon. It depends on the individual, their personality, what is available, the kind of attitudes they have, what they like, kind of thing. Because we all are not, turned on by one thing. So someone may be turned on by one thing, someone may be turned on by one thing. Like I'm a person who can never be addicted to cell phone. I find it very hard to just look at a small screen and do some things in that. So that's one thing I'm very sure of, and I'm very happy about that. I have no risk of running into that addiction kind of thing. Same, I think, would be for many people that that some people like something in drugs also. People have a choice. People may have tried various kinds of substances, but then they choose one particular thing. So some people like stimulants. Some people like depressants. Some people also going for polysubstance use kind of thing. So I had one client who was into polysubstance use, and he would actually So what we figured out is that he actually enjoyed that his mood state would change very quickly. Because he wanted to change his mood state very quickly. He couldn't be with one particular mood state for a long time. So if he's happy for a long time, that would become very distressful for him. So he needed to take something to calm him down. When he was calmed down for a while, he used to enjoy it. But then he needed something to bring him up kind of thing. So it's like, I mean, a lot of individual variation really governs that kind of thing. Yeah, so before we go to this one, anyone would like to say anything or comment? Yeah, please, ma'am.
I would like to ask you one thing.
Yeah.
You are elaborating ways of addiction, different types.
Right, yeah.
But are we also discussing the remedies?
Sure, we'll come to that in the end, because I thought that, I thought it's appropriate to start with, what is addiction, then go to why addiction, and then go to, what can be done about it. Yeah.
Remedies and rehabilitation or something.
Yeah.
Those are the answers people are looking for.
Okay. So, do you want me to really jump to them? Okay, we'll be surely coming to that. Yeah. Anything else? Yeah.
Just a question. Are people happy being addicted? In a sense, I understand that they're content or satisfied or they've escaped or whatever the adjectives you want to use. But are they happy? I've never seen one, but you seem to have seen a lot of such cases. So do you find them to be happy no matter what the addiction? Are they happy being addicted?
Okay. Yeah, so that's a very interesting question. That are they? Yeah.
Sir, as you said that there is often a mismatch in parenting. So as we come from a more of collectivistic culture, so are the chances of mismatch more in our society as compared to Western? And can it be one of the reasons for addiction in a lot of cases?
Okay. See, more or less is hard to say, because I think that our society has many advantages which the Western society does not have. At the same time, we have quite a lot of disadvantages which the Western society does not have. But yeah, I mean, I was actually talking about the rage aspect of it, kind of thing. That I feel that in our society, and I'm not talking about the experience and the expression of rage. That I think might be very similar in both the societies. But the struggle with the rage in our society is like very intense. Because I'll tell you one very interesting thing that for instance, when we are taking on people in psychotherapy and working with them, and as compared to many people who do in West, it's very easy for people to kind of share negative emotions towards their therapist. I had one person who kind of had to say something about something slightly negative about me kind of thing, and he kind of waited for 150 sessions kind of thing. I mean, to be precise, would have been 146, 147, but I'm just kind of going into that. So I mean, the struggle with the rage is there. About your question, I mean, see, what I feel is that that it provides some kind of a holding. So it is doing something for them, but their happiness is not the real happiness, and it's not a long-lasting happiness, kind of thing. So there's this beautiful old song, na, "Main zindagi ka saath nibhata chala gaya, har fikr ko dhunएं mein udata chala gaya." If you hear the whole song, so it's a lot about that how the addiction is kind of helping him, but also you also get to hear he would be talking about his struggle, pain, and stuff like that. So I think that's what I mean. It's a very a very vivid kind of description of how it is for an addict, that they are happy but they're still hollow kind of thing.
And the form also says that life is to move on, it's a forward journey.
Right. Yeah.
Can I say something?
Yeah.
Hi. No, I just wanna. You were saying before about the Indian culture and the Western.
Yeah. Please.
Yes, of course I am the only one, I guess. But anyway, I think I am from Italy and I lived in the UK for a long time.
Okay.
I lived in America. I am a psychotherapist myself.
Okay.
And I think when we talk about the West, we have to be very careful because the West is very big. There's so many cultures, and even if you think of Europe and you think of Italy and the UK and how differently they see emotions, they express emotions. So it's very important, especially in our profession, to be culturally based and culturally aware. And when we talk, especially in certain roles, we give people information and then they need to be very precise.
So please don't talk about the West.
Okay, yeah. Sorry, my mistake, but
No.
you should have told me earlier. I would have not said it.
How you spoke against the West? You said certain better things are there which may not be according. What's he talking about?
No one. I'm saying.
We learn so many good things from them.
No.
We respect their values, etc.
I'm saying that the Western is very diverse. You cannot just generalize.
There's a lot of difference.
I'm saying you cannot generalize. No, there's no India and the West. It's many things into the West.
Okay, let's stop here before we get into the India versus the West, before we get into Mr. Manoj Kumar and Puram and Pashchim, let's stop here for a while.
In India itself, so much diversity is there. Within India also.
Sorry. But actually, when we are talking about cultures, we generally actually end up making very sweeping statements. So my apology for that if something has gone wrong.
Psychology are all addictions bad?
No. See, according to psychology, addictions may be just a dysfunctional way of dealing with yourself, but they are still a very important way of dealing with yourself. So I and Neetu and all who practice, we really have a lot of regard and empathy for a person's addictions. Kind of thing. I have developed that regard. It's been a journey. No, we are not. I'm not, but I'll come to that. It has been a long journey. I didn't train like that. I was also very nasty, had very nasty attitude, but it has been a journey. I'll come to that. So I think now we should just rush for a while. Otherwise, sorry. So coming to addiction as a loved one. Right. So see, there's something that we call in psychoanalysis the capacity to be alone, which is different from loneliness. So you could be in a room with your own self, but you could still be at peace with yourself, you could still be happy. Or you could be in a room alone with yourself and you could be damn distressed. So that's what capacity to be alone is. That you are with your own self and you are happy. You are happy, content, at peace. So it is what we say that it is a developmental achievement. That in both we are physically alone, but in the capacity to be alone, we have an emotional and a mental presence of someone. And in loneliness, we have no presence. We need someone. We need someone concrete.
One can be also lonely in company. One can also be lonely when one is among other people.
Right.
So it's not only physical.
True. I mean, by capacity to be alone, it would be that people who are lonely, you are very right, that whether they are physically away or they are physically between people, they would still feel very lonely, kind of thing.
But somebody who is physically amongst other people and is still lonely, is that like a higher development for you?
Sorry, I wasn't just shifting that. Yeah.
I'm asking you if somebody is in the midst of a number of people, but he is alone in his own thoughts or whatever. Would you classify that as being more mature? Like you said, it's a developmental achievement, right?
See, it's very hard to just take this one fraction and comment on, because there are various factors. How does the person feel inside? How does the person behave? How does the person go about his life? How do people around him feel about that? So there are various factors before jumping into judgment. So if that relates to someone, we can talk after the talk, and I can take in detail and then maybe give you my thing on that. So people who are addicted, they have a lot of what we call unmet dependency needs, and they need a constant sense of being accompanied, that someone is with them, that some presence is with them. So they need to create that presence. It could be via various means. Right, and a very interesting short thing that I tell you about this capacity to be alone and this loneliness. So I actually was working with someone who would come to the sessions and who would be absolutely silent, would not say a word, would come to the session, would get up and go back after the session, kind of thing. And it went on for many sessions. Initially, I in his presence got very
I would feel very uncomfortable, very panicky, and stuff like that. And I started really reflecting on all those emotions, and I had a feeling that maybe that's what this person also feels inside of him, and he's trying to kind of giving me a feel of it, kind of thing. And as our work progressed, we spoke we did not speak much, but there were these very long periods of silence. I at a certain point started enjoying that silence. I became very comfortable. I had very fond experiences of that silence, and I could also make out that that in the meantime he also has been developing that capacity, so that I'm seeing that reflection inside of me, kind of thing. Yeah, so the need for a constant presence is provided by the compulsive activity. Yeah, so someone was talking in the beginning about pride and self-esteem, someone from here, yeah, so addiction is also as a pride for some people, kind of thing, Yeah.
Thing is addiction only due to the emptiness or a kind of vacuum that you are feeling inside? Or since I deal with a lot of things, I at times feel that they are looking actually for a thrill. So it's a growing up mood.
Right.
They're looking for thrill, adventure, which they eventually get it from drugs, smoking,
Right.
or maybe through Facebook.
Right.
So I think it's a need of that thrill that is driving them, especially the adolescents,
Yeah.
to some kind of addiction, and not necessarily all the times the vacuum or the lack of peer pressure.
See, about the thrill aspect, what I would say is, like, if we go back to what we had discussed in beginning, that many people are recreational users and experimenters. We generally, and that's a very important question. That that almost everyone experiments, with something or the other, but not everyone ends up being an addict. That all adolescents, have various peer pressures. They go to parties, they are doing things, but not everyone is getting addicted, kind of thing. So it's a lot about that when we are talking that why that addiction means that someone starts using that thing as a crutch. So when someone is just doing it for recreation or a thrill, it's like for this that you would want to do it and then you want to be back, kind of thing. But when you constantly need it, that's what addiction is. In that, even in those cases, some of these factors may be really operating, kind of thing.
What are dependency needs?
Dependency needs, that's very psychological. To put in a very normal language, that you need someone, you need someone with you, kind of thing. You need someone to take care of you emotionally. You need someone to tell you that you are doing fine. You need someone to guide you, kind of thing. These very simple things. So yeah. And yeah, so coming to this point, addiction as a pride, that there is also a very narcissistic basis to addiction, because that's a very important thing. It's a very natural and a healthy human drive, I would say, to feel in control of oneself, to feel good and to feel strong. All of us, we may be having the worst experiences of our life, we may be in shatters, we may be in severe trauma, but we still somehow want to feel good about ourselves, and we want to feel that, that I am not a passive victim, I am in control, I can exercise my control, I can stop this, I can rise, So that's what, that we all need a good, strong sense of self. Helplessness, we all experience helplessness, and it is something that we all hate. It's one of the very difficult states to be in. That when you feel that you just can't do anything, you are doomed. You can't do anything. You can't go anywhere. You are stuck. You are trying to move, but you are stuck. And the moment we feel helpless, there is a very natural inner need to undo it, to somehow just, move out of it, to do anything damn, even if it's like, smashing a glass, if you are feeling very helpless, you'd still want to smash a glass and, still get rid of that state, than linger on in that state, So you would do just anything to get out of that state, that you need to just get this, and for the people who feel very helpless, that they, one patient, he gave me a very vivid description. He said, it's like an iron ball inside me, that's kind of crushing me and crushing me and crushing me, and I need to just take it out and, you know, throw it out from my system, you know. So that's what helplessness is, you know. It's a very traumatic, you know, thing for yourself, you know. And so, when we are getting addicted to something and it is helping us, you know, take care of this helplessness, you know, that we are very sad, we are in trauma, we are empty, we are feeling rejected, we are feeling abandoned, you know, and we just take a shot, you know. So it also restores this sense of, you know, pride and this good sense of self, that, oh look, I'm back in control, you know, I'm back with my own self, I can make a difference, you know, kind of thing. So that's also what, you know, would lead to it. Coming back to that, you know, the case of this lady who was having, you know, casual sex encounters. So she used to really report that what I would really enjoy in those encounters is not the sex aspect, but this feeling that someone is finding me attractive, someone is finding me desirable, you know, someone is kind of, you know, holding me high in his mind, you know. So that's what, you know, addiction does, you know, that it kind of gives you a narcissistic boost, you know. It makes you feel temporarily good about yourself, but that temporary feeling of goodness is like, you know, really worth for some people who are really struggling a lot with, you know, intense pain and their, you know, self-esteem. Right, but the flip side of it is that in the long run, you know, this very process, you know, that people get addicted because it helps them take care of their helplessness, but in the long run, when the person actually finds out that they are really dependent on this, you know, and now every time they feel helpless, they need something external to kind of, you know, make them feel high, their self-esteem actually crumbles further, kind of thing, you know, because they feel very depleted from inside. They feel that there's nothing so good inside them, you know, which can hold me in one piece, and I can't really do anything on my own internally, you know, to make myself feel good. I need something external. I need this substance, I need internet, I need alcohol, I need drug, you know, kind of thing. So in the long run, it has this flip side. Right. So I'll go on to, you know, we'll finish this section and then we'll take a few questions because, yeah.
In a broad way, could you tell us how many percentage of people, you know, they suffer from this thing? As you have been dealing with this, how many percentage and how many of them they overcome on themselves, and how many of them you help in treating them, and how many of them go to Brahmlok with this addiction?
See, about the percentage thing, okay, I'm actually a very bad person to ask because I don't see many people. I see very few people, and I do very long-term work with them, you know, so I don't see, like, you know,
it's a problem our society faces.
Yeah, but I don't really feel that I have the expertise to really comment on, you know, those statistics, because I deal with a very, you know, I deal with a very handful of people, kind of thing, you know. So, and my entire talk is really based on that, you know. So
it's the major problem.
Yeah, it is, and there are very alarming and interesting statistics also, kind of thing.
And so many people cannot get rid of.
Right. Coming to addiction as a form of self-punishment. Yeah. So what happens is that conflicts are very common in relationships. You know, that we feel intense love and intense hatred and intense rage in all our most important relationships in our life. But on the whole, you know, and that's very important, that on the whole we need to feel good about people who are there in our life. You know, I mean, everyone feels, you know, rageful, bad, angry, sad, you know, with important people, but we ultimately, everything said and done for psychology can help, you need to have a overall good feeling. कि चलो, you know, कुछ अच्छा किया, कुछ खराब किया, but you know that they are my parents, that's my girlfriend, you know, that's my friend, kind of thing. You know, I can still bank on this person, right? If not, if people don't have this overall good feeling, then there's a lot of destructive rage, you know, because when you feel, you know, that people have been unfair to you, you simply want to get back at them, you want to destroy them, kind of thing, right? And when you have rage towards the most important people in your life, so what happens then? You know, there are two things that happens. That one is that you feel very scared and very vulnerable because you are actually wanting to attack in your mind people whom you are dependent on, people whom you live with, people whom you look up at in times of distress. So that makes you very paralyzed with fear. And as we discussed, that intense emotions can be a very important thing, why because if you feel very scared, you would really need something to deal with that fear. The second thing is guilt. That people also, because in a close relationships, when you are very rageful and violent, inner mind towards the people whom we are dependent on, we also have maybe a conscious or an unconscious guilt, and it's killing. It's really very killing. And when you feel guilty, so what happens is, guilt में एकदम से U-turn हो जाता है कि जैसे मेरी rage, if I'm angry with her, my rage is going like this, and I'm kind of and then when I start feeling guilty, it takes a U-turn and comes back to me. So I feel that I somewhere internally feel I'm bad, I should be dead, I should be punished, I'm a horrible person, I'm a hollow person, and all these things. So, yeah, so the anger that was meant for someone else is now turned back towards my own self, and I would have the need to kind of punish myself. एक और variation भी होती है at times. There are some people who are very ruthless. I mean, guilt भी होती है, but still the anger is there only kind of thing. They don't take this U-turn. So in those cases, what happens is that they would still do self-destructive things, but with the intention of inflicting the pain on the other person. That if you are in love with me and I'm hurting myself, then I'm seeing you cry, kind of thing. So that way, addiction is also becomes, that kind of, that it's very closely linked to punishing your own self or punishing someone in your life. Yeah. Yes, please. Yes, please. Yeah.
What is the best treatment?
You please sit and talk. Yeah.
I'm
okay. Please. Yeah.
See, let us say there is a person with these kind of difficulties, and what's your what is the best treatment one can do? Let's say I have a person whom I know, and he is suffering from this thing. Right? To whom should I send him or take him? Okay. So that he gets and what is to be done for him and how to be done?
Okay, we'll come to that in the last part, and then maybe I'll take it up in the detailed kind of thing, right? Okay, I just need to rush a little bit now because both of them also have to add their valuable insights. So, yeah. And in some cases, there's a direct equivalence of drug use with suicide. That also happens in some cases. That some people have such a strong wish to die or to punish their own selves that they would kind of, do it. Right. So now we would just come to the end part that everyone had been mentioning that we should take up. This is on healing addiction. Right. See, when we are talking about healing addiction, more than like doing very usual kind of self-help stuff, because there has been a lot written on, that what self-help is there for an addict, what do you need to say, what do you need to do, what do you not need to do. Yeah?
Disconnected.
Oh, it's again disconnected. Someone help with that. Yeah. So, but here in this thing, we are also looking at the deeper processes that you need to look at, address, in order to help someone, who is addicted. So I'll start with very common convenient biases which we all have, and I also have had in my own past when I started. So most of us have some biases, Like one very interesting thing is that people say, addiction is all biological. You take a substance, then you simply kind of, you are, biologically hungry, for that substance. So there's nothing about your mind, emotions, personality, and that is a simple bad habit, which needs to be dealt with, And So, the second common thing is that, this also, many people will say that addict is essentially a bad person. It's a very moralistic kind of a bias. That they can never change. They are bad. They are bad. They are mischievous. They don't wish to change. The third is, and it is also very common that an addict needs, harsh and punitive treatment. That people would say, even when they are doing, empathy or stuff like that, they are talking to the person, but they would really want to get a Pandey with a stick in their hand. Ki, ab to change hona padega, now you won't. So that comes like, also in this, very common kind of a thing. So, but what may be, and when I'm talking about, the psychological truth, I'm, saying it from my angle, what I have discovered. I don't really need to say, that this is the psychological truth. I'm sure that, that if some of you people have been dealing with this or would deal with this, you may come to your own conclusions. I'm just sharing my own conclusions over here. Right. So the first thing that the biological bias, what I kind of, got from my experience, is that it's actually very hard to segregate mind and body in any kind of, explanation. And addiction is a very complex phenomenon. Obviously, when you are taking something, both your mind and your body are interlinked, and I mean, to give you a very, common example which does not speak about addiction, that if I am here and if a lion comes in the room and is just about to pounce on me, right? So at this moment, if someone were to do a functional MRI of my brain, they would obviously see various neurotransmitters, shootings, imbalances, chaos in my head. So that's the biology of it. If someone speaks to me, or if I later on speak to someone, I would just have a lot of words, feelings, felt sensations, images for it. So mind and body, they go hand in hand kind of thing. We can never say that something is completely mind, something is body. I think it's a very useless debate to get into that. The second thing is that most of the addicts hope and wish to change given good enough support. ये जो वो good enough support है, that's a very very tricky thing. So we'll be talking about it. कि what kind of a support does an addict need, right? And that if we use a harsh and a critical treatment, they actually end up reaffirming the addict's belief that I can't really rely on someone, no one can understand me, and eventually there's this substance which will help me kind of thing. So they kind of, once again, they are like, heartbroken. This is like the most important thing that I have learned through my work, and I'm sure when Neetu would talk, she can also reflect on that. That when, the moment you are, the moment an addict comes to you for help, or is there in your family circle or your friends, most of the times you think on that I have to work on him, I have to change him, but there has a lot needs to be done about your own feelings, about your own emotions, about your own attitudes, about your own dealings with that person. A lot of internal work kind of thing. Right. So the first thing is that we need to deal with, the negative attitudes which despise and hate the addict kind of thing. That quite a few of us have a very negative image of someone who's addicted, and it's but natural. चाहे आप कितनी भी empathy, कितनी भी sensitivity लेके चलो, if you are feeling negatively towards someone, that will really color the way you see things, color the way you interact. Even if you keep shut, because human senses are so strong that the message actually goes. My look, my silence, my way of welcoming you, my way of looking at you, my tone will tell you, kind of thing that do I feel negatively about you or not, kind of thing. Right. The second important thing is that we need to see them not as bad people, but as struggling human beings in need of assistance. That is something, that due to our own biases, many times we fail to see, because we all have very strong, like I'll tell you from personal example. I am a person who really likes to be in control of myself. So when I started working with these people, I would actually feel very irritated, because they are the ones who have no self-control. They don't have self-control. So I would, so that was going against my own philosophy, and I was very uncomfortable, you know, I was very uncomfortable that how someone can lose control kind of thing, you know, so that was really coloring my work, you know, with them for a very long time kind of thing. Yeah, so I eventually realized that I need to be comfortable with my own, you know, maybe dependent and needy parts, and you know that, because it was very important for me as a person, you know, that if something wrong happens, you just need to pull yourself up, you know. So I would have a very hard time understanding and relating to someone who was unable to pull themselves up, kind of thing, you know. I would also go into, the comments that I would say, or what I would say it in my own mind is that, come on, it's such a small thing, you know, you are just sad, you are just lonely, you know, why can't you do something about it, you know. I would still not say it to the person obviously, but my attitude would really color my work, kind of thing, you know, because they were able to sense that I could not really, you know, understand them and could not be with them on the same emotional plane as they were. Right, now this thing is very important. See, because as we said, addictions are defenses against helplessness and narcissistic injuries, you know. So when you take on this very noble task, you know, very difficult task of healing an addict, so you actually invite a lot of helplessness and big narcissistic blows on your head, you know, kind of thing. And you have to develop an inner strength, you know, for that, you know. I'll give an example. Like there was this one patient who is still in therapy, but has many therapy sessions, kind of thing, you know. And this person would again and again go back to drugs, you know, after 2 months, again back to drugs, after 2 months, again back to drugs. He would still be continuing therapy, but would be slipping in drugs, kind of thing. I would really feel very helpless, you know, and my pride, you know, because we all, like if I'm working as a psychologist, I would really like to, you know, tell people, or if other people know that this person is coming to me, I would really desperately want that people should think I'm a good psychologist. And it was a very huge shame for me that, look, you know, my patient with so much of therapy goes back to drugs after every 2 months, kind of thing, you know, needs a hospitalization every 2 months. And that would kind of, you know, really kind of, it would make me internally angry, and I would simply go out of touch with, you know, what this person was going through, kind of thing. Until I kind of, you know, realized this, you know, that I'm somewhere struggling with my own helplessness, you know, kind of thing, and that, you know, that I don't feel so strong enough within me that I can, you know, deal with this blow that someone is coming to me, but someone is not improving, kind of thing, you know. So interestingly, you know, that, and I, you know, there was, you know, that this same patient, at times he would be very hyperactive in the session. He would come, he would crack jokes, he would laugh on my face, he would, you know, say, you know, he would not let me speak anything the moment I'll open my mouth to say anything. He'd say, my God, you know, you need so much of importance, it's my session and you need to speak, kind of thing, you know. It's my session, my space, I'm paying you for that, you know, so why do you need to speak at all, you know, just allow me to be here and do what I want to, kind of thing, you know. And I would really go through very difficult emotions, you know, I would feel very battered, I would feel very helpless, and I would, you know, get into these, you know, that, that if you are suppressed, so you need to really, you know, take your weapon up and flash back, you know. So I would really want to get back and say that, look, you know, I'm here to help you, and, you know, I would come in that mood that I'm a psychologist, I know, you know, that what should be, you know, the best. But then after a lot of reflection, I, you know, kind of realize this, you know, that I am somewhere very uncomfortable, you know, with these things. And interestingly, once I learned to tolerate, you know, once I learned to tolerate my own helplessness and getting battered, you know, kind of thing in therapy, I would also actually understand that this person also was somewhere struggling with those experiences only, you know, because what happens is that for many people, what you feel very hard to deal with in your own self, you do something to inject that feeling into the other person, kind of thing, you know. So this person was doing the same thing, you know, that he himself, he was down to dust, he was kind of in shambles, and he was injecting this experience in me. And once I learned to develop comfort for that, we could relate on a very deep emotional level, and he could then begin to form an attachment with me, and he could then have this feeling that the therapy can contain his feelings, his loneliness, his pain, and he could then rely on me. See, because for anyone who was struggling with all those so many emotional and self-related issues, they actually need a very strong and reliable and consistent presence on whom they can rely on, kind of thing. Until unless they find that kind of a presence, it's hard for them to really deal with that.
Is this presence should be in the family or professional?
Ma'am, it can be anywhere. कोई भी अगर ये काम कर सकता है, whether that's a family person or whether that's a professional person, because I mean I do feel that healing happens in multiple contexts. It's not that it would just happen in a rehab. It can happen in family, it can happen by a friend, it can also happen via various means. It can happen via an ideology, via a philosophy, but the person should get that kind of a strong board that I can rely on this. चाहे किसी के पास कोई ideology भी हो, but if they feel that this can really take care of my distress, they do show a change, so and that's really the best part about human nature. No matter how screwed up we are still waiting to कहीं ना कहीं हम ढूंढ रहे होते हैं कि कोई एक एक्सपीरियंस, कोई एक ऐसा एंकर पॉइंट मिलेगा जिसको we can hold and we can kind of heal. We all have a tendency for that. Right, so that I've talked about, that many times in order to escape our helplessness, we resort to very harsh measures, kind of thing, which we need to control, because when you feel down, you have a need to attack, kind of thing. So with this patient, मुझे एक बार तो ऐसे लगा, because he never had a history of bipolar disorder, bipolar symptoms नहीं थे, तो मुझे लगा कि he's laughing so much, कहीं इसको mania तो नहीं है, and I was like, इसको भेजो यार, इसको ना किसी psychiatrist के पास भेजो, जिसको कोई दवाई देके इसको चुप कराए थोड़ा, kind of thing, So that's the kind of feelings and attitudes that you can have, which are like very difficult to, because when you are, और यही होता है, with addicts there's actually a lot of struggle, because we feel so impatient, we feel so helpless that we need to really do something strong, we need to hold them by their horns, and kind of do something about that. And actually that's what we get really involved into the whole drama of addiction, कि जिन चीजों से deal करने के लिए addiction बनती है, we end up kind of colluding in that. Right. Another important thing is that we need to also tolerate addicts' grandiosity, and that's a very important thing. That when you are feeling very low, within your own self, what would you do to change it? You need to kind of come across as someone who is like on the top, and that is also an explanation that that many times when one talks to people who are addicted, they'll simply say, I don't have a problem. You keep on telling them, no, you have a problem. This is a problem. You're spending so many hours on internet, or you are taking so much of alcohol. Your reports say that your liver is kind of dying. They say, no, I don't have a problem. It's you who thinks. So that's also what happens, that an addict has a grandiosity to them. Now, and why someone needs to feel so powerful, because somewhere internally they're feeling very powerless. What we tend to end up doing is that we very quickly want to break it down. We want to tell them, we want to show them their place. That no, you are wrong. That this is thinking too much, this is talking too much, kind of thing. But what is actually required is that you need to tolerate the addict's grandiosity. You need to establish a bond with them. You need to keep channels open, and you need to kind of come to that point where they start relying on you. Actually what happens is when someone really starts relying on you, so the grandiosity that they have been holding towards their own self, that gets shifted to this other person, and they start idealizing you, kind of thing, and it's then when the work can start happening. So that the grandiosity which is towards the person's self has to be turned, into some other direction, and how you can do it is actually by simply giving space to that grandiosity, by tolerating it, by being with it, by developing a very empathic understanding that why someone would really want to come and make you feel down to dust, because this person is really struggling with this internal experience, So there's this image that's coming to my mind, which is from religion, but I don't mean to say it in that sense that I'm, promoting one religion over another, but it's a very apt image, of Lord Shiv, that he holds the poison in his throat. He does not take it in, So when you are working with an addict, I think that's a very, vivid and right image, that you have to hold that emotional poison in yourself. You don't have to spit it back at, the person. If you can do that somehow, then there would be hope and then there would be change. Right. Now, interestingly, what happens is that we were talking about the grandiosity aspect of it, that when the grandiosity starts turning into idealization, that when the person starts looking up to you as this, bankable figure, then the person has a very, very intense need to attach and to be held. And it can be, why also at times we can't help addicts is because we are scared of offering too much, or we are scared of very intense attachments. Not so much maybe in a personal context, but also in a personal context also, but especially I have felt it very strongly in context of psychotherapy. There was one person who would after the session I would say fine, time up, and this person would sit like this. I don't want to go, do what you want to do, kind of thing, Now what you can do, like after 15 minutes you have someone else, kind of, waiting outside. The best you can pray is कि ठीक है यार 15 minutes तक और ये बैठेंगे, kind of thing. So that's very important. Or you can, get a lot of phone calls outside your time. You can get a lot of messages. Someone can simply, one patient at one point of time will say, I'm too distressed. I just feel good when I come to you. So I just want to come to your house now. And it's not. See, these are not people, because there's one very particular class of people जिनके साथ आप बड़े मजे से fantasies में काम कर सकते हो कि अच्छा हमारे घर आओगे तो घर आके क्या करोगे, घर में क्या होगा, वो आएंगे नहीं घर पर, वो बात करते रहेंगे कि घर आके क्या होगा. There are some people who would actually land up at your house, who are wanting to land up at your house. फिर क्या करेंगे, kind of. So these are very important issues, that you can't really give into so much, but yet you have to be very sensitive. You have to be very sensitive. You have to be very holding in responding to and attending to these people, kind of thing.
Temporary attachment also, like you are addicted to the mind, not passing. Sorry,
you are reminding me of my patient. Right. No, I'm almost done. Yeah. Okay. Right. So I'll just read out these goals. Yeah. So what we need to do is that build on the emotional tolerance and provide empathy and emotional nurturance. Providing a reliable presence which can be internalized, to beat that inner sense of loneliness, and this all can be done through a very strong relationship and bond. That's what I want to emphasize. That the main key to healing or dealing with addiction is a very strong, reliable, bankable, consistent relationship. Building on their self-esteem by identifying and highlighting their strengths. Helping them express rage. Rage would also come in therapy towards you or in real life if you're dealing with them, and also helping them to deal with guilt.